Hey, so good morning, everyone. Let us learn our new topic for today. Basically, we have already covered one session on this diuretics. So today we will be covering one more session on diuretics. So in the last session, we have discussed among these diuretics their basically introduction, where we I mean to say our afterload and preloads. So diuretics are known for reducing the content of afterload and preload related to heart disorders, and also they are useful in hypertension, because in hypertension, if you want to use these substances as antihypertensive substances, then these are the one of the choice of good choice of drugs for as antihypertensive drugs. So basically, these diuretics are known as water pills. Means generally they will increase the output excretion of this sodium ion. Basically, can be caused by these agents. That's why they are termed as diuretics. So there can be several therapeutic applications for all of these diuretics. It can be used in chronic heart failure or nephrotic conditions or chronic hepatitis, etc., etc. And yes, hypertension as well as edema. In some of the cases where it can cause edema, so in that case also, in this kind of pathogenic conditions, these are the substances which can be highly useful. Okay, so now next is cirrhosis of liver. Normal physio is that also one of the disease that it is used. Normal physiology of urine formation, and basically two important functions of the kidney are there. One of them is to maintain the homeostasis, balance of the electrolytes and water. So that is also there. Basically, these are the physiological conditions and other features we have discussed previously. The same case are also here. And nephrons are composed of those glomerulus, proximal tubuli, distal tubuli, upper ascending loop of Henle as well as the descending loop of Henle. So these we have already seen yesterday. So this is basically one about 1200 ml of blood per minute flows through both of the kidneys, and various ions such as sodium, chloride, calcium, etc. are there, which are known for their absorption as resorption from the nephron. If the urine contains above, then it will represent some other disorders. Then in this case, we need to treat with all these. Urine is a one where basically uh, patient will have all the this balance electrolytes and these conditions, etc., etc. So they are generally normalized in this condition, and there is no big uh, I mean to say some challenge for that one, right? But another kind of condition, what is called as this oliguria. Oliguria is basically a pathogenic condition where the patient will have less amount of blood flow, less amount of this urination. So majorly it is said that less than 13 ml of urine should be output from the body. But oliguria is a condition where this urine output is less than the normal one. So that is called oliguria. Another pathogenic condition is called as polyuria. So as the name suggests, poly, so that means it is excessive. So excessive urination is called as polyuria. If it is, I mean, considered. Right? Hematuria is a condition where the patient will have blood in the urine. So that is called generally as uh, hematuria. Okay, so now let us learn the classification. जिसकी हम बात कर रहे हैं several types of diuretics and the substances which can cause diuresis. So we are going to discuss those all diuretic substances. So these are the various substances such as loop diuretics. Loop diuretics are the one of the potent diuretics, which are also termed as high ceiling diuretics, as or they are the most potent substance because these substances they are used in on only let us say 10 milligram, 5 milligram, sometimes 2 milligram. Even for the dose of the infants, this diuretics furosemide is given for 1/4 of the pill to the patient either in the early morning or in the before the once time in a day. This is generally given, not more than twice to the infants, and also it is given to some other patients also. In that condition, it may be given, let us say, 2 to 3 times in a day. So these loop diuretics are the potent diuretics. On small 10 milligram, 5 milligram of these compounds can cause excessive diuresis. That's why they are termed as, I mean to say, potent diuretic substances, or they are termed as Anthranilic acid is a substance which you have visited during your first year found identification of unknown organic substances. So there you have visited this, and basically you this is having a phenyl ring as well as NH2 and carboxylic acid, which are present at 1,2 position. So during this time you might have seen this uh, anthranilic acid. But the major important thing is that at the para position of the nitro group, there is a presence of sulfonamide, which is called as SO2NH2. Okay, so this is basically furosemide is used for this purpose, where it is having sulfonamide at the para position of this, and also chlorine is one of the substituent which is present in this furosemide, right? And this is a substance which is 5-membered ring having although a cyclopentadiene oxyanalog of cyclopentadiene, and that is called as furan. So this furan ring is present in furosemide. Okay, this is a potent diuretic. We will see the side effect of this potent diuretic. Basically, loop diuretic furosemide is no can cause uh, this ototoxicity and nephrotoxicity. It can cause kidney failure, renal failure, or it can also cause the loss of hearing capacity of the ear. So this can be lost from the excessive use of furosemide. Okay. Then carbonic anhydrase inhibitors such as acetazolamide is one of the another drug. Acetazolamide, as the name suggests, is 1,2,4 thiadiazole class of the compound, and that is having this sulfonamide functional group SO2NH2, and that is having this acetamide NHCOCH3. That is one of the functional. Okay, this is basically carbonic anhydrase inhibitor, and carbon, as we have discussed previously, all of these carbonic anhydrase inhibitors generally act on proximal convoluted tubuli, which is called as PCT, and there basically they can show this kind of inhibitory action against carbonic anhydrase. And we know that they can also cause the excretion of bicarbonate ions into the urine. These are the only kind of this only kind of diuretic substance which can cause excretion of bicarbonate ions, HCO3 minus and ions into the urine. Okay, 1,2,4 thiadiazole. This is another kind of potent diuretic which is called aldosterone antagonist. So aldosterone is basically one of the hormone which is produced by adrenal gland, which is just situated above the kidney. Yesterday, in the last session, we have seen that some of these adrenal glands which is there. So adrenal gland is known for production of this adrenal medulla we have, adrenal cortex we have. So adrenal medulla basically produces adrenaline, and adrenaline is one of the neurotransmitter which is present, which is required for neurotransmission in central nervous system as well as peripheral nervous system. Majorly, it is a part of peripheral nervous system. But aldosterone is basically a kind of hormone which is produced by this cortex, and that is essential for this excessive urine that can cause to inhibit the excretion of the urine. So that is the major concern of this. And aldosterone is basically once this aldosterone is released, then it will then it will decrease the urination. Okay, so that way it will sensitize the some other way of mechanism. I will not go into the depth of how the way aldosterone increase, or how the way aldosterone reacts or gives its mode of the action. But if we use this another substances, what is called this I mean to say, if we use this aldosterone antagonists. Aldosterone antagonists are generally known for the purpose of inhibition of, or the purpose of urination. So they generally increases diuresis. In that case, the urine output will be maximum. Okay, so these are the substances. Spironolactone is a substance, as well as amyloride. Spironolactone is a kind of steroidal substance having a 5-member cyclic ring, and cyclic ester is present in aldosterone. So that's why it is termed as spironolactone. And amyloride is basically this kind of pyrazine ring nucleus is present, and one for this as diazobenzene, you can call it this substance, and that is having similar kind of character. Here, basically, a guanidine functional group is present, and that's why it is basically termed as this kind of this amyloride. Okay, so that way, these potassium-sparing diuretics are known, and they are generally sparing. So they are what they will do. They will spare the potassium ions, and they will try to reabsorb the potassium ion, increase the reabsorption of potassium ion. Absorption और reabsorption में difference है. मैं आपको बताता हूँ. Let me tell you and clarify it to you. When these Bowman's capsules and etc., they create a glomerulus into these blood vessels, which are basically which contain the urine. So they will create the glomerulus, and uska jo outer part hai na, that will be covered on the nephron. Absorption is generally एक तो होता है कि excessive amount of chloride ion, sodium ions etc. वो blood में से urine में चले जाते हैं. And still, if body feels the demands of certain absorption of which is called actually in fact a reabsorption of so chloride ions or sodium ions or potassium ions, तो यूरिन में से वो इन आयंस का रीएब्सॉर्प्शन होता है और वापस ब्लड में चला जाता है, मे बी थ्रू दिस लूप ऑफ हेनले और कलेक्टिंग ट्यूब्यूली और डिस्टल कॉन्वोल्यूली. So, or yes, so these are the places where reabsorption of urine can be possible. Okay, so this is a way that they will increase the design. So aldosterone antagonists, basically they are known to act on collecting duct where they are this collecting tubuli. So where they will increase the reabsorption of potassium ions. So that's why they are termed as potassium sparing diuretics. And that way it is known. Thiazide diuretics. So, as the name suggests, thiazide. So, these are the substances which contains thiazine ring in their structure, and basically it is in cyclic sulfonamide. As you can see, SO2NH2 is there, but it is a part of a ring. That's why it is termed as cyclic sulfonamide. And hydrochlorothiazide and chlorothiazide are the substances which are known for this. Hydrochlorothiazide. So, as the name suggests, hydro. So this is a one for nitrogen position over here, and this is the second position which is over here, which are having saturation. That's why it is termed as hydro. Okay, it is chlor because chlorine is one of the functional group which is present in this substance. एक चीज आपने मार्क किया होगा कि whether it is furosemide. I mean to say, whether you are reading the furosemide, so even there is a presence of chlorine. Even if you are reading this amyloride, there is a presence of chlorine. Even if you are going to, let us say, chlorothiazide or hydrochlorothiazide, there is a presence of always chlorine. So all this gives the kind of SAR impact that chlorine is essential, or chlorine increases the chlorine increases the diuretic action. Okay, so instead of fluorine, bromine, or iodine, always this chlorine is having potent uh, anti potent diuretic action. Okay, and in majority of the cases, it is always ortho to sulfonamide. Look at furosemide. Chlorine is ortho to sulfonamide. So at second position of this, whatever the substitution is that, whether it is saturated, unsaturated aromatic ring, or likewise this, that is always there. Here also, look at to this one. At second position, ortho to sulfonamide, chlorine should be present. So all these hydrochlorothiazide and this chlorothiazide, these are the drugs which are known diuretic. So let me clarify you this thing that there is a difference. How is that structural point of view? Structural point of view, thiazide diuretics are 6,6 bicyclic compound, and they are having this cyclic sulfonamide into their structure. That is basically thiazide. But the thiazide-like diuretics are the one where basically they are this is sulfonamide is present, but in fact their mode of action is same. But thiazide-like diuretics don't have this 6,6 sulfonamide or a 1,1 dioxo this tetrahydro uh, sulfathiazine. Okay, so that is present in thiazides, but the same is not present in this. But their mode of action is perfectly similar as thiazide diuretics. So that's why they are termed as thiazide like diuretics. Okay, sometimes जैसे बोलते हैं ना कि let us say someone of you may be a good batsman just like Sachin Tendulkar, but that fellow, let us say one of our friend Hamza is batting very well. Okay, so people might feel that he is Sachin Tendulkar of your Farm D LMCP team. Okay, but in fact he is not Sachin Tendulkar. He is like Sachin Tendulkar, or he may be like Virat Kohli, or somebody may be like, let us say, Chahal or some other, right? Some other Indian cricket batsman or bowler or even spinner as well. So that way we are giving ye iske jaisa hai, uske jaisa hai. So that similarly thiazide like diuretics are like term for this purpose only. That they are in fact not thiazides. Their mode of action is not just as good as thiazides, or sorry, they are not in fact thiazide diuretics, but their mode of action is as good as thiazides. So that's why they are termed as thiazide like diuretics. In other words, we can call them as thiazide mimetics. जैसे होता है ना parasympathomimetic, parasympatholytic. So we can call them thiazide mimetics, but people also used to call them as thiazide like diuretics. Yes. So chlorthalidone and metazolone, these are the additional two. These are the two